तुझे रस्सी पे कुछ मत टांगना।
Yeah. If you can show, WhatsApp no. WhatsApp ini mesti set no. But
We
Thảo chim rồi thôi. Ini cần khen rồi đó. Mute.
Mute itu.
My ignorance was such that I had no idea of the wonder and beauty of life. It is this sentiment that is echoed by those who suffer from cancer.
I used to smoke berries, but did not know what could happen. If I get well, that will be good. My son dropped out of school because of me. He wanted to be an engineer. So when my treatment started, it all stopped. His schooling stopped.
My son would have become an engineer if not for his illness. Our poverty would have come to an end, wouldn't it, if he had become an engineer? How long will we be able to continue working?
The influence of tobacco is not only on adults, it is also affecting children.
My name is Poonam and I'm 7 years old. I chew Ketal Gutka.
The ill effects of this terrible habit start early, but are often only visible later in life. By this time, it is often too late.
I developed the habit when I was young while hanging out with friends. I had no idea that I would face such a problem at such a young age. I never even thought about this.
The cancers caused by chewing tobacco can occur at a young age as well. This young lady was diagnosed with oral cancer within just 1 year of tobacco use, and she's just 27 years of age. Smoking reduces one's life by 10 years.
Use of tobacco in any form can cause cancer. Cigarette, bidi, pan, zarda, khaini, mawa, or the edible pan that is freely used. You cannot even imagine the dreadful types of cancer that are caused by all these things, and the devastating havoc that it wreaks on the body.
Approximately 27.5 crore people use tobacco in India. 35% of adults over the age of 15 use tobacco in some form. Passive smoking also has physical, emotional, and financial effects on non-smokers. Even a child or a young person can fall prey to a range of diseases and ill effects, such as sudden infant death, pneumonia, asthma, even heart diseases.
On 25th May 2011, we found out that he had cancer through the biopsy report. When I see anyone I know using tobacco, I feel sad. And I try to discourage them, but they make fun of it and say that nothing is going to happen.
Every year, more than 10 lakh lives are lost due to tobacco.
She used to apply masheri filled with tobacco. The doctor said she has cancer.
1 out of 10 deaths every year are caused by smoking.
I started smoking at the age of 16, and the damage that was caused by smoking, I'm having to suffer now. My windpipe has been removed, and there is a hole in my throat that I must use to breathe.
Life is to be lived beautifully and not destructively. Stay away from tobacco and secure a safe future for yourself and future generations. Support a tobacco-free nation.
नासमझी का आलम कुछ यूं था कि हंसी जिंदगी की खूबसूरती को भी न समझ पाया। कुछ ऐसा ही कहता है उन सब का दिल जो कैंसर से पीड़ित है।
पहले बीड़ी पीता था तो ऐसा मालूम नहीं था कि कैंसर हो जाएगा। अभी तो ठीक हो जाएगा तो अच्छा होगा। शिक्षण छोड़ दिया मेरी वजह से मेरे बच्चे ने। वो इंजीनियर का कॉल आ गया था उनको, तो मेरे इलाज पे आ गया तो उनका इलाज बंद हो गया, स्कूल बंद हो गया।
मेरा लड़का जैसे बीमारी नहीं आती थी तो इंजीनियर होने वाला था। अभी अब हमारी गरीबी चली जाने वाली थी ना, वो इंजीनियर बनने वाला था, तो कब तक काम करेंगे हम अकेले। अब
तंबाकू का दायरा सिर्फ बड़ों तक ही सीमित नहीं है, बल्कि अब कम उम्र के बच्चों को भी ये अपने अंदर समेट रहा है।
मेरा नाम पूनम है और 7 साल की हूँ। मैं केतल गुटखा खाती हूँ।
बचपन में लगी इस बुरी आदत का नुकसान भविष्य में भुगतना ही पड़ता है, और जब तक ये बात हमें समझ आती है बहुत देर हो चुकी होती है।
बचपन में फ्रेंड के साथ आदत लग गई थी। अभी मेरे को एक्चुअली मालूम ही नहीं था कि मेरे को इतने कम उम्र में ऐसा प्रॉब्लम हो जाएगा। मैंने इस बारे में सोचा ही नहीं कभी।
तंबाकू चबाने से होने वाला कैंसर बहुत छोटे उम्र में भी हो सकते। इस युवती को तंबाकू चबाने से सिर्फ 1 साल में मुंह का कैंसर हो गया है, और ये सिर्फ 27 उम्र की है।
धूम्रपान आपकी जिंदगी के 10 साल कम कर देता है।
तंबाकू किसी भी रूप में लिया जाए उससे कैंसर होता है। सिगरेट, बीड़ी, पान, जर्दा, खैनी,
Dia mute kamu coba.
Mute memang sound saya.
Ada dia mute sana. No.
Dr. Lana, can we welcome everyone? Good morning, everyone. I hope I'm audible. I'm thankful to all of the participants, DCs, SPs, various school teachers, stakeholders from NIGRIMS, and everyone has joined. We are just waiting for our Principal Secretary, sir, to join in a minute or two. Once he joins, we will start immediately. This is a very important meeting where we have participants from police, school side, health side, and this is a very important meeting in that sense. So I request patience for a minute or two. We'll start quickly. Dr. Lana, I hope I'm audible to you.
Yes, you are very audible, Mr. Ramkumar.
Thank you, Doctor. Dr. Lana, you are on mute.
Yes, sir. I'm sharing the link with Principal Secretary. He's asking for that again.
Yes, please.
Oh, no. Yeah.
Has a link been sent to his email ID?
Yes, sir. I've sent to the PA, sir. She's asked.
Okay.
So should I send to his WhatsApp number?
Yeah, send it to WhatsApp number. Or send it to me also, I can send it to you. In this case.
Yeah.
We've also resent it to his email ID, Mr. Ramkumar.
Okay, thank you. I'll let him know. Principal Secretary sir has joined, so I think we can start. Secretary Mr. Cyril also will join in a minute, I hope. We can start, Dr. Lana. I think it's already 10 minutes.
Thank you, sir, very much. Thank you.
I'll just check with some. Sir, are you there?
Yes, Ram, I'm there.
Okay, sir, we'll starting then.
Good morning, sir.
Morning, Dr. Lana.
Good morning, sir. Very happy you're here, sir. Thank you. I have a presentation. Good morning, sir. Our Principal Secretary, Sri Sampat Kumar. Then our Secretary of Home for Police, Sri Cyril Dendo IS. then the Secretary of Education, Sri Ambrose Marak, all panelists, the Deputy Commissioners of all the respective districts, the Superintendent of Police from all the respective districts, Dr. Caleb Harris, Dr. Siddharth, Mr. Ranjit, and to all the participants of today's webinar, including the headmasters, the teachers, the BDOs, and BRCs, CRCs, and all the staffs from Education Department. I take this opportunity to welcome all of you to this very important webinar, which we have been looking forward to for a very, very long time. I am Dr. Lana Emika Lingdo Nongri, the State Nodal Officer looking after the National Tobacco Control Program, National Health Mission, Meghalaya. This webinar today has a very, very important agenda. And the topic for today is stopping sales of tobacco near schools, which is a part of the ToFEI, which is the Tobacco-Free Educational Institution. So this stopping of sale of tobacco near schools is also a Section 6B of the CORPA, Cigarettes and Other Tobacco Products Act 2003. And it is also an activity 9 of the guidelines of the ToFEI. So why? So this webinar today, it is very, very important because of so many reasons. The most important reason is the prevalence. As we can see here in the Global Adult Tobacco Survey, the prevalence of tobacco use in Meghalaya is 47% in adults aging 15 years and above. And also in the recently released Global Youth Tobacco Survey, it amounts to 33.6% in children aging between 13 to 15-year-olds. So because of this high tobacco prevalence, both in adults and children, we also have a very high cancer rate in the state. And this prevalence has also shown that we have a lot of cases, and we have around about 8,000 tobacco deaths every year. So these are the 3 important reasons of why this webinar today is important. But our main focus is for the children and for the youth, because at the same time, I would like to inform to the whole house that we have here a tobacco industry also which is coming in between all the time. The more efforts the government of India or the more efforts the stakeholders are making, the tobacco industries, they have really mastered the art of how to catch hold of all the young boys and girls, and they want to catch them young and bring them into this whole tobacco menace in the state as well as the country. And the way that they have manufactured the products also, they have manufacturing in such an attractive manner that all the children will fall prey into this habit. So because of this whole tobacco menace in the state, and especially when we look at the percentage of our children, the health department, and especially our mission director, Sri Ram Kumar, he took a major decision by thinking in terms of implementing this ToFEI in a very, very big way. So with his guidance and with his initiation and with Sir's strong decision, we carried this forward in a very strong manner by incorporating and by bringing in the education department, and where we had communicated with Sir Ambrose, who is the Secretary of Education, and Sir also, he is one of the backbones of this ToFEI program in the state of ours. And in fact, it is Sir Ambrose, then he gave a strong order and a strong directive to all the districts in the state, where he has asked each and every district, each and every school to comply with all the 11 activities. And at the same time also, just education and health could not just work alone. We also tied up with Sambandh Health Foundation, which is a non-profit organization. And this foundation also, it is a very, very updated foundation where they have an app-based application and methodology, which makes the implementation of ToFEI also in the state of ours in a very simple and a very, very organized manner. In fact, technically, they are the ones who are carrying this implementation also forward through this application. So the schools in Meghalaya, they have all been brought in, and they have also been discussed and been sensitized with all the 11 activities of the ToFEI guidelines. So initially we started this pilot with 5 districts from March until July. And the pilot study proved to be very, very satisfactory. And within a very short period, many schools have already been brought into the loop. And after seeing and being satisfied with the implementation, this program was extended to all the 11 districts from the month of August 2021. So till date, from March until date, we already have 7,000 plus schools in the picture in this whole program. And even the activities also are increasing in such a rate, though they have not been able to comply to all the 11 activities, but they are complying to a minimum of at least 1 activity from the guidelines. And so we have crossed around about 31,000 plus activities, ground activities in this program. Now we can see here in this district-wise data, we can see the percentage here, the total number of schools that are in the program. And we have seen in each and every district, the districts that have started in the initial stage during the pilot study, they have a higher number of schools and with a higher percentage, and also with the higher number of activities complied. So this is progressing in a very smooth manner, and we are happy that they are well versed with all the 11 activities. So, but today, as I said, that the most important activity is activity 9. That is no sale of tobacco within 100 yards of any educational institution. So as we progress and as we speak, as we practice, these schools, they have already responded, and it's very good to see that they have started reporting the number of shops selling tobacco within the 100 yards of their educational institution. So we are getting around about 5,926 schools reporting. And out of this, it shows that 43% already have reported that they have tobacco shops within their vicinity. So this is the figure and the percentage of the involvement of the schools. Now, even this chart, this data, which I am highlighting here in the screen, we can see we have all the 11 districts in the picture, and we have like all these other districts, some districts at 47%, like Southwest Garo Hills, and East Khasi Hills at 54.2%. And we have West Garo Hills at 27.3%, which we are expecting more from them in due course of time. And we have South Garo Hills. Yes, South Garo Hills, total number of schools 68 and number of shops 20. So we are expecting more reports from the schools in the next few days and weeks. Now, but at the same time, no matter what effort we have taken, and in spite of all the efforts being taken by all the stakeholders, by all the departments, we can see that the sale of tobacco near schools is a persistent problem. In some states, or even here, we do not know, they come, they stop the sales, and then again they start. So, and because of this problem, we are also having high court orders, since 2010 to stop the sale of tobacco products within the 100 yards of the schools. And we also have an expert, Mr. Ranjit, who will be highlighting more on how he dealt with these legal issues when it comes to the sale of tobacco products or other substance abuse. So he will be highlighting and he will be sharing. So because of this, now we are very active, but at the same time also we really need a sustainable model so that this stays and this whole method or the whole system will be well placed in our state so that it becomes a continuous process from now onwards. Now, as I have mentioned in the previous slide, that we already got the list of schools with violations sent, and we have sent to all the respective deputy commissioners and also the respective superintendent of police. And here we are happy also that the district administrations and also the police department have acted very promptly on taking this whole issue into their account. They have constituted respective committees and also the enforcement committees where they will be acting, and many of them have acted upon these violations. And the program have also sent feedback forms to all the schools where they fill and providing us all the reports, whether action or warning has been given to the schools near the respective schools. So we are getting feedback in 44 to 48 blocks, and the districts that have started taking action on these violations, 8 districts. And from these feedbacks and from their responses, we have come to know that the sales near the schools is about 51%, that has stopped or reduced. So this is something that is very encouraging to the whole implementation of ToFEI in our state, but we will try to keep going with the same momentum. So I express my gratitude, sir, and to all the authorities of my state, for their continued support, and also for all the important decisions taken by the respective departments. And it's because of the support and the decisions, important decisions taken by all the respective sirs who are present here in this panel. We are happy that we are progressing, but still, so we need the continued support of everyone so that this keeps going. So I take again this opportunity to thank everyone at this moment. And even the teachers also, I welcome them again to this session, who is still left, and we will be getting a lot of enrichment from the rich resources, and which will help us in strengthening this implementation and also to go forward in a more powerful and a strong manner. So thank you. This is the end of my presentation for today, and we will carry forward with the presentations of our other panelists who are here. Thank you.
Thank you, Dr. Lana. I think we can go to the next item.
Yes, sir. So now we're also happy to have Dr. Caleb Harris, a cancer surgeon from Negrims. And we also have Dr. Siddharth Sangma. He's also a surgeon, oncosurgeon from Tura Hospital, Christian Hospital. And these two have been very, very instrumental, in bringing in all the voice of tobacco victims whom they have seen. And we get their testimonials very often, which is also a message to all the people who are taking tobacco here in our state. So I welcome Dr. Caleb Harris to kindly share his experiences and your victims.
Uh, Good morning, everyone. I'm really glad to be part of this, and I'm really happy. It's really heartening to see the kind of efforts which have been taken in Meghalaya, and we hope that Meghalaya becomes a model state for the entire country in preventing victims of tobacco. And if you see tobacco, I'm not going to talk to you today too much about what all tobacco can do, because I know all of you are aware of the ill effects of tobacco. And the biggest advertiser, the biggest source of information about tobacco, the biggest source that tobacco causes harm is the tobacco packet itself. 80% of the tobacco packet, it shows some gory images. Some of the images might have been photos which I've clicked when I was in TMH in Tata Memorial Hospital. So these sort of, next slide please. So if you see these images are there everywhere, and tobacco causes damage from head to foot. The next. So, but then people still continue to take tobacco. So why would that be? So one of the reasons is probably because tobacco targets the impressionable minds. They catch the people young when they are not in a capacity to decide on what is good and what is bad. And I come from the state of Rajinikanth. I'm sure most of you would know Rajinikanth. So he is probably one of the, he has recently been awarded the national award also for acting. And Rajinikanth popularized smoking in a lot of indirect ways, probably because every school child, every college going kid would always want to aspire to do what he did on stage. And that was what the way he flipped the tobacco, the cigarette sticks. And that made him a hero, but then it made a lot of people to get into the habit of tobacco, because that is what people thought tobacco will give them. They thought that flipping a cigarette will make them a hero, but in effect, this is what it made them into. It made them a zero. And that is why we want to show today what exactly will happen when you take tobacco. Are you going to become like Rajinikanth, or is something else going to happen to you? So we will like to show you a short video of a patient who was my own patient. So we'll just hear him talk. Manish, please play. So once he speaks, I'll tell a brief about this patient. So he was a 45-year-old patient, and I treated him around 4 years ago. So he presented with a cancer in his tongue. Manish? So, I treated him.
Just play.
Yeah, please play. So I operated him 4 years ago, and by God's grace, I would say he's been doing well so long, but still his life has changed a lot. And that is what we are going to hear from him.
Hello viewers, नमस्कार युद्धे। मैं आप सबको ये बताने के लिए कोशिश कर रहा हूँ कि सिगरेट मत पीजिए। मैं सिर्फ ये चाहता हूँ कि जिस कैंसर बीमारी से मैं शिकार हुआ हूँ, जिस कैंसर बीमारी का मैं शिकार हुआ हूँ, आप ये बीमारी से बचिए, क्योंकि ये बीमारी बहुत परेशान करने वाला है। आप जिंदा तो रहेंगे, लेकिन आपकी ज़िंदगी बर्बाद हो जाएगी। आज मैं इस कैंसर बीमारी से 4-5 साल से जूझ रहा हूँ। ये तो मेरा नसीब है कि आज से 4 साल पहले मैं निगरी हॉस्पिटल पहुँचा। वहाँ के डॉक्टरों ने मेरे जीभ का कैंसर ऑपरेशन के जरिए ठीक किया, लेकिन ऑपरेशन के बाद आज मैं अच्छी तरह बात भी नहीं कर सकता हूँ। इसलिए मैं आप लोगों से रिक्वेस्ट करता हूँ कि सिगरेट मत पीजिए। सिगरेट से बहुत परेशानी होती है। सिगरेट से आप ही अकेले नहीं, बीमार तो आप होंगे, आपके साथ आपके पूरे परिवार को इस बीमारी से भुगतना पड़ेगा। वो लोग भी आपके देखभाल में लगे रहेंगे। इसके वजह से बीमार आप है लेकिन परेशान।
Yeah, we heard the impassioned plea of this patient who has suffered a lot. But I would try to reiterate, at least he was lucky enough to escape. As in, he is now disease free for the past 4 years, and probably he'll be able to live for some more years. But then look at the way he's speaking. He was earlier working as a salesperson, and now because of that, he's not been able to, because he can't speak, he's not gone back to that job. But luckily, somebody has given him a job as in a clerical position, and he is able to make ends meet. But look at the way his family has been transformed. He has a wife and 2 young kids, and their life has changed a lot. And that is why he is giving such an impassioned plea. He also probably thought that maybe nothing will happen if he smokes a few cigarettes. But that is what has happened to him. Probably he also thought he'll be a hero one day, but then it has been contrary. Yeah, Manish, can you play the next video? So we might all think that he's a
Dr. Caleb Harris ko matel nagdaska jan negams ni onko surgeon wachum angko ang nigaman agan nagda ang nama yung ahachme ko agan nagda angko kaman na matela ang cancer sagaba rangoni saksa waha jen salo ang bulsi tuning achum kapan rani takako nakim mo nga dekai sada cha biri nga takabarang ko nga
Yeah, thank you. Because there are many people here today who may not be able to understand Garo language. For want of time, we'll stop that video. So I just wanted to show you this patient. He is only 27 years, and last year he was diagnosed again with a tongue cancer. And today he is not in a position to probably come on because he's still undergoing treatment. So he was operated and he received radiotherapy also last year. But then this year, a few months ago, he was diagnosed with another cancer. So initially the cancer started in his tongue, but now the cancer has come from the lung. So that is something very important. The entire body can be affected by cancer, and this can hang on for a long time. So he started, sadly, smoking at the age of 11 years. Just imagine, at the age of 11 years, he started smoking because somebody in his school introduced him to it. And then he continued on till he was 18 years of age. And later on, due to maybe some influence, due to his church or whatever influence, he stopped it. But that damage was already done. The damage by the 7 years of tobacco use, it hung on to him, and at 26 years he developed a cancer of his tongue. We operated and gave radiotherapy to him, but still he's come back now with a lung cancer. It has already spread to all parts of his body, and he is on some chemotherapy now, and we don't know how well he will do. So this is the very sad thing. While he probably would have thought that smoking would make him a hero, on the contrary, this is what has happened to him. He's probably looking at a short lifespan also. And it is his inability to probably decide. Maybe with the other person, we might all think that, okay, he made his choices in life. But what kind of choice do you expect an 11-year-old to do? Even for sexual intercourse in our country, we feel that less than 15 years of age, they are not in a position to give consent. So even if it is a consensual relationship, it is still considered rape. So how much more for this? For tobacco also, we should apply the same yardsticks. At 11 years, 12 years, they are not in a position to decide for themselves. And it is our responsibility to stop sale of tobacco. The more it is easily available, the more they will take to it. And I would make an impassioned plea to all of you people here. You're all in very responsible positions and very powerful positions. And I would request you all to do something about this and make sure tobacco sale near schools is stopped. Thank you so much.
Dr. Lana?
Yes.
Yes, sir. So now I take the honors of welcoming Sir Mission Director Sri Ram Kumar, so who is the main architect of this ToFEI implementation in the state of ours. I welcome you, sir, and I thank you for all the support. So, sir,
Thank you, Doctor. Thanks a lot. And I would like to first of all welcome everyone. There are more than 1,000 participants who have joined from, as I mentioned in the initial brief remark, from Education Department, from the police side, and as well as from the health department side. This is a very important discussion because many times what happened during the COVID and other in COVID and even before COVID, the cancer has cancer actually has taken a slightly a backseat, unfortunately, and we are aware that Meghalaya is quite a cancer capital for the country, particularly Shillong, and this part where this part of the country as well as this part of the state, because and quite a few of the most of the cancer of that is all ENT related or chest related cancers, and one of the most important reasons to be attributed is for tobacco related reasons. I would like to first of all thank Dr. Lana for making all this possible. I think she is the torchbearer. But we have taken that coordinated efforts and to make this happen. My second sincere thanks would be to Mr. Ambrose Marak, who has always supported this kind of initiative. Without a cross-departmental coordination, this cannot happen with this much participation. I would also like to thank the doctors from NEGRIMS who have joined, and other medical officers who have joined from Tura and elsewhere, and also from Samman Foundation who have joined. And finally, I would like to initially thank our Principal Secretary, who has always been a big source of support for all kind of initiatives, and our Home Secretary, Mr. Cyril, who has also taken his time today to join, and also, despite his multiple engagements, has been able to be here. I would like to, because Dr. Lana has given a very clear presentation on what is the purpose of this meeting, and what is the problem we are looking at, and what is this kind of solution. I would just like to take a small setting of a context why we have called all of them for this important meeting. Point number one is, as I said, Meghalaya is quite a cancer capital, and I just wanted to give a brief this thing in National Health Mission, where I am as a team we are working here. A lot of people I know in the office smoke. So I used to ask them in the meeting, where did you start this habit of smoking? Invariably, every smoking habit starts between the age 10 to 15. Most of it, 90+% is between the age of 10 to 15, which is the most impressionable age, where the children are trying to form this peer group, trying to get validation from different groups. And this part, they're trying to get validation through some or other. They want to become part of a group. One of the easiest ways to go and smoke or get peer pressured, and this becomes a big problem in the school settings. So the core people to prevent cancer rather than curing cancer is another task on its own. It requires such a very curative levels of treatment intervention, and with a state like Meghalaya where these are not available at all levels, it's very expensive, expensive in terms of affording the care, as well as also expensive in terms of loss of income to the family because of having cancer. Someone is having cancer and becomes more of a burden to the family rather than an asset to the family. So because this habit has to be stopped, and this can happen only at the school level, and that particularly at the age of 18-20, if someone can hold out this habit, the chances that someone can pick up this habit after 20 is considerably lesser. This multiple researchers across the world has actually shown. So we wanted to take this opportunity to kind of bring in a lot of partners, collaborate, and get this awareness of avoiding tobacco and awareness of ill effects of tobacco, and what is the future problems which we are looking at. Dr. Caleb Harris had actually shown and made a very small but very strong point of how impressions from movies and etc. can actually play a big role. Similarly, in school level, teachers are supposed to expected to play this role of being a role model and talking to this at least once in a week of avoiding these kind of habits, tobacco, particularly tobacco consumptions, and also about, of course, about sexually transmitted disease and other things, but particularly avoiding tobacco consumptions and talking again and again about this will go a long way. This is one time of preventing the habit. Other type of supplying of tobacco products is where we brought this app with the help of the Samman Foundation. We were very happy to take it up, and today it has become a national best practice. I would like to tell everyone, in fact, we had a similar meeting a week back with other MD-NHMs of Northeast, where Government of India had organized us, and we were presenting the same thing. We have put this app in all the school teachers who can report that there is a sale of tobacco happening in these kind of schools and etc. Because the police force is also overstretched in terms of numbers and kind of responsibilities they have. So we would like to give a ready-made information of where exactly a crime is happening so that we can prevent it. The reason why the police department, the Home Secretary and other SPs have been asked to join is basically to see to that if this action taken on the complaints, if it can be that complaints can be at least up to 80 to 100%, this will go a long way in actually creating awareness, because people selling tobacco, they're also victims of this entire, I would say, slightly stronger corporate mafia, where they also don't know that they are selling a product which is very, very harmful to the people. They think it's okay, some harmful, but not great. My life is important. But if they understand that it's selling harmful, that can be done through awareness, and also that can be done through this checks and balances, which we have through this applications and this thing. And children are a very captive market, because they go by, even selling candies or selling chocolates or selling anything. They are a very captive market for these kind of gratifying small things. And it is not very expensive also. I still think a cigarette has become more than 10-15 rupees today. It's very expensive, but still children might feel that 2022 I can afford, children want to grow up very fast. So in mind, they would like to always act like an adult. They will try to find ways to act like an adult. And one of the ways is taking consumption of tobacco. So creating awareness is one part of it, and avoiding, trying to stop the supply of tobacco to the hands of children is the other part. So we are trying to, teachers, we have requested to join to create that awareness, as well as to give that information on the app where these tobacco things are supplied, and the police department can actually take action on them. Even a warning, even a minimal action can actually send a signal, because those people who open the shop regularly near a school are actually, that is a source of livelihood for them. No one wants to spoil their livelihood by taking a risk like that. So that could be a important deterrent for selling of tobacco. So as Dr. Lana had actually shown in her presentation at the end of the slide, there has been a considerable impact. 8 districts have taken action. We're very thankful to that, but this has to improve a lot. This can actually set a model for the entire country, how a good coordination between health department, police department, and education department can go a long way in actually preventing a problem for the future. So that's why we are very concerned about it, and we are also very passionate about it, and we wanted to spend time on this matter so that we can actually solve a problem of the future. It's already a serious problem now. We can reduce the seriousness of the problem in the future. So that's the context setting why I wanted to tell for all of them who have joined this meeting. This interdepartmental coordination, which has been made possible because of involvement of Mr. Ambrose and the entire education department team at the district level. District school education officers also have been very cooperative. We're very thankful to them. And from the police department, from Secretary Home to all the IPS officers, all the SPs and OCs also who have stepped up their action. So my only request is to intensify this action and to keep the tempo so that we can actually do much better and reduce the incidences of cancer and cancer-related diseases. So with that few words, I would like to once again thank for all of you for joining on this nice morning. And I would request all of you to take this as a takeaway for your for the day, and to think about this, and actually even small steps. Everyone takes a small step on this matter, we can actually go a long way in reducing this, because this is actually equally a problem like a tuberculosis, and even today as much as a COVID issue. That is the level of the problem. Just that it does not get that visibility, it does not make it any less of a problem. So once again, I would like to thank everyone. I would request Dr. Lana to call upon our principal secretary, sir, because he has another engagement a little earlier. So if you might.
Yes. Thank you, sir.
Yeah.
Thank you, sir. So as per request by our principal secretary, Sir Sambat Kumar, I will request, sir, and I also take the honors of welcoming Sir Sambat Kumar to this important webinar. And sir, we are looking forward to your address to all the panelists and to all the participants in today's webinar. Sir, I would like to say that at the very first step when we initiated this ToFEI, we were very happy when we also saw your enthusiasm and your passion by giving us a strong directive to make this ToFEI implementation in our state in a very big way. Yes, sir, we are trying with our best, and we have reached this far also, sir, because of your support and your guidance. So I welcome, sir, to kindly address the participants on this today's webinar.
Thank you, Dr. Lana. Thank you, Mr. Ram. I think I wish everyone a very good morning. And it's a very important initiative taken up by the NHM in collaboration with the Education Department and Home and Police Department. I hope this is, and also I think we should add Social Welfare Department too. This is a very important thing. The reason is that, in fact, Dr. Lana has shown us the data, how severe it is in Meghalaya. Meghalaya, has a serious problem. 8,000 people are dying because of tobacco consumption in the state. 8,000. It's a huge. And we are entire state got shaken when the COVID has taken away 1,000 deaths. So 8,000 our deaths are happening every year. I think it's a maybe that is a very serious issue. And all of us, I think you might be aware or not. I think I'll ask some question. Maybe you can in the chat box, I think you can actually respond, the participants. One is that how many of you are aware that the life expectancy, the average life expectancy in Meghalaya, can somebody text average life expectancy in Meghalaya, not the doctors who has read that health policy. Those who have not read the health policy, I request you, the teachers and the education department officials and other people, just type. I wanted to see at least a 10, 75, 68, 65. Okay. Okay. So 71, 62 to 70, I think. Okay. So that's one question. Then the second question I would like to ask, okay, fine. Okay, that's good. So I'm very happy that you are very optimistic that whoever has typed 70, 75, they are really, optimistic. But the truth is that our average life expectancy is only 62.5 years. Can you imagine? Average life expectancy. So that means a huge, this again, one of the contributory factor is this tobacco and cancer. So people have to understand, one, of course, there are some other issues are also there. We have high, maternal mortality and infant mortality, because children, when they die at a very young age, when you average this entire life expectancy, so you definitely, you get a life expectancy very low. So one is this. So we need to, we all have to really, especially the education department, I would like to say, because it's a very important role to play. In fact, this is something that we need to teach our children, how important it is, to work on that positive health. Children have to be told what is the importance of this entire positive health, and especially these parameters, these indicators, what is this IMR, what is this MMR, what is this life expectancy. These are very, very important. So people have to be, our India, average national life expectancy is over 5 years, more than the state average. And if you go to the developed states, it is almost like 80 years, 79 to 80 years. So we are, far, below than the global, life expectancies. So I just wanted to give one example of this. Then the second thing, to work on these things, we need to bring that consciousness, we need to bring that consciousness right from the childhood. So we need to use different platforms. One platform is the schools, definitely a very important platform, where I would request Mr. Ambrose Mara to actually, at least, the teachers have to, we have to take a survey. How many teachers are non-smokers? If the teacher smokes, how actually a teacher can teach a child? So it's like a Gandhian model. So we should actually take a survey of like how many, the people who are in the responsible positions are not, do not have this understanding. Then maybe we have to talk to them. We need to have a detoxification camps for the teachers, suppose if they are actually smoking. I'm just saying. So some of these things are very, very important. So we need to come up with a Gandhian approach, towards this particular thing. Yes, yeah, as you mentioned, in fact, Dr. Kalib has given a very good example of Rajnikant. We all actually, the young people in the college, they don't even understand, what they are doing. So they are, so I think there is a lot of other influence. So we need to bring a different kind of a narrative in Meghalaya. This is not good. So Meghalaya, so I think we have to leverage our community model, because our communities, when they understand something, they follow very seriously. The way behavior change management, when the COVID times, when we introduced this behavior change management strategy, even in the rural areas, people started following. So I think we need to bring that kind of a, behavior change management strategy even for the tobacco. So let us, I think I request MD NHM to work on that behavior change management strategy, how actually we can bring this, involve the communities, especially the traditional institutions. Now we are actually, it is with Mr. Cyril now, like there is we are bringing a village health council, idea. It's like a health districts within the state. First time in the country, where elected bodies are going to manage the healthcare interventions on the demand side in the villages in the state, so that it's going to the cabinet, gets approved. So what happens is that in every village we will have village health councils with active participation of every community. There is an elected body, they would be interested upon this responsibility. So maybe these village health councils can be used for the behavior change management strategy for tobacco, anti-tobacco. So tobacco, there are better things that one can do rather than the smoking, in fact. So that's something that we need to bring a new culture. I think if we can do it and turn around this consumption as quickly as possible, and now that New Year is also coming, maybe that can be a big resolve. I think this particular on New Year, January 1st, I think there should be a resolve should be taken across all the schools that we will not smoke. And some of these resolve, I think it may be required. So we need to bring a different kind of a culture in terms of changing these things. But the very step, I think, as what Dr. Caleb and Dr. Lana was mentioning, that this the access to this cigarettes should be, the tobacco should be minimized by in fact making the schools completely tobacco free, and the home and political department, and with the help of the district administration, to remove all these this particular access near the schools and colleges. That can be done. So that also maybe can be done. And to make it even more, basically this we are talking, but to also to measure what we are doing, I also request a kind of an independent study, at least once in a, like a 6 months we should have this study, or once in a 3 months we should have a study to understand how these efforts are actually being implemented, so that we can also take necessary course correction measures. So with this, I again thank everyone for active participation in this particular webinar. I think first time I'm seeing in Meghalaya, a webinar has got more than 1,000 participants. I think it's a pretty, that itself shows the kind of a resolve that collective resolve that all we have, and also the kind of a the initiative that is being taken up by the NHM team, Mr. Ram Kumar and Dr. Lana. So I congratulate all of you, and I also thank Mr. Ambrose and Mr. Cyril for their active participation. Thank you very much.
Thank you very much, sir, for your strong message and your strong support, sir. And we know that we will be getting across your powerful address, and especially when we heard from you about the behavioral change pattern that we will need to bring about to the children. And yes, sir, we will be moving forward with that kind of an approach. Thank you, sir, once again for coming. And at this moment, I also take this opportunity to welcome one of the most important person in this whole program, and that is Shri Ambrose H. Marak, IAS. He's the Secretary of Education. Sir has been very, very, very instrumental, and he has helped the program by involving each and every staff of the education department from the block level. And we thank you and welcome you, sir. And we look forward to your address to all the participants. I welcome you, sir, to please take your part.
Thank you very much, Dr. Lana. Thank you, Mr. Ram Kumar and Sir Cyril for participating here, and Sampat Kumar, who has been the mentor of this whole ToFEI program in the state of Meghalaya. And a very good morning to everyone present here and who are participating in this webinar. I am very, very grateful to the health department and the home and political department for steering this program, because this ToFEI program in the state of Meghalaya is very, very important, as we have seen in the presentations how this use of tobacco has already catch the state of Meghalaya, particularly the young boys and girls in the state of Meghalaya. It has been a great pleasure to work with the health department and the police department, home and police department. And I will not be able to speak here much because I have been talking so many times to the participants, various participants in the state of Meghalaya in respect of this ToFEI program in the state of Meghalaya. Here I would like to mention there are two kinds of cats here. That is tobacco producers and the tobacco users. Now I would like to ask, who is going to bail these two cats? Is it the police department, or is it the only health department, or only the education department, or the doctors, or every teachers? But I think it is a duty of every one of us to get rid of these two cats so that our young children will not be suffer and they will have a long life expectancy in the future. Therefore, I would like to request all the participants, all the teachers, and particularly the young children to carry this program in a mission mode. Sir Sampat Kumar in his address has said that to conduct a survey among the teachers who are smokers and non-smokers. When we go for these surveys, I would like to request and appeal the teachers to be very, very honest, because this survey, which is going to take place, is very important. If you are honestly saying that I am a non-smoker, then we will have a very good survey. If you are not honest and saying that that I am non-smoker, and if you still smoke, then the program is going to be not successful. Here, I would like to thank all the participants, and still I would like to appeal to all the teachers, school principals, who kindly take this program very seriously, because the life is very important. The life of our future, the life of our young children is very, very important, and we will have to take care of them. So with these few words, I would like to thank the foundation, the doctors who are spearheading this program. And from the part of the education department, we would like to pledge that we will give support to all the torchbearers of this program. Thank you very much once again, and we look forward our program will be a very successful in future. Thank you very much.
Thank you very much, Sir Ambrose, sir. And we are very, very confident, and we are very, very motivated the more we hear from you, because we know, sir, the more we hear from you, the more strong we are. And with all the staff from the education department and under your leadership, sir, we know that ToFEI will be 100% successful in the state of ours, and we will surely go and get your message across. And I believe that each and every participant from the education department will really go with that takeaway. That is the strong message and strong directive from you. Thank you once again, sir, and we look forward to meeting you again and to more coordination with your department. So at this moment, we will move forward again to another important message, an important address by one of the most important secretaries that we have here. And so we welcome Shri Cyril Darulong Dingdo, IAS, Home Secretary, to this webinar, sir. Thank you, and I welcome you. And sir, under your leadership, under your supervision, the police department has been actively working on the enforcement, be it in Shillong. There has been an active role by the police department, where we have been able to find all the violators, especially in the zone 3, zone 4, in Police Bazaar, in Yom Maulong, and that is very challenging for us, but we are still going ahead, and every day we are doing the chalaning in these areas with the police team and with the district administration. And we also look forward for the same kind of enforcement, a strong enforcement in other districts. And I hope, sir, that after your address, your strong message will be going across to all the participants, especially the police officials. And I welcome you, sir. Kindly take your chair. Thank you.
Thank you very much, Dr. Lana, for that kind introduction for me, and very thankful to our Principal Secretary Health, Shri Sampath Kumar sir, and the entire health team, Mr. Ram Kumar, who's MD NHM, Secretary Education, Mr. Ambrose Marak, all the DCs who have joined today from various districts, all the SPs, all the other experts, the dignitaries who have spoken, and of course, all the other participants. I think this is very promising in terms of the number of participants, as our Principal Secretary Health mentioned, which shows that this topic of tobacco and cigarette smoking and its harmful effects is gaining momentum. And however, we need to have decisive action points at each department level. And I'm thankful that health, education, and the police and the district administration have come together to work out what is the best mechanism to enforce the provisions of the Act, and also to ensure that there is adequate awareness that can lead to something actionable for each person. As Mr. Ambrose mentioned, I think all of us are important stakeholders, and directly or indirectly, all of us are bound to suffer if this trend continues. I mean, the numbers are startling, and this really must be publicized, and people need to know this in local languages of the harmful effects of tobacco and cigarette smoking that is really affecting us as a state in terms of our human resource, and obviously it affects human development as a whole. And the strategy really would be to involve all important stakeholders. Let me first begin with the police department. I think, the police have been doing its part in terms of fining. I have data about number of persons fined, amount collected for smoking in public places. However, on Section 6 violations, I think a lot more can be done, a lot more needs to be done. And obviously it needs to be done with a level of awareness. And as we mentioned, this survey is very important, because unless we know what's our baseline, to know exactly what exactly is the demand, the supply, the way it works, then we'll be able to tackle it effectively. So my request would be, and there are SPs who have joined us, and we will work out a proper effective mechanism to, to review this, especially number one, SPs to review this every, fortnight or every month in terms of what exactly is happening on this front, because we know that there is huge demand, huge sale, because the numbers show it. Let it be an important agenda for each SP to, take up with all the SIs, the constables, so that the message is passed on to each and every police official. That is important. Each police official should know that their duty also is to raise awareness about this very harmful aspect of cigarette smoking and sale of tobacco products. So that is one, a systematic way in which this can be reviewed. Mr. Ramkumar mentioned about, the app and how this data can be generated. I think data is very important, because unless this data speaks to us, like Sir Sampath mentioned, 8,000 deaths, that kind of data has to be brought in so that it really ensures that there is that level of seriousness and commitment to ensure that this is not something, that has to be just kept aside as a low priority. But really, since it affects our children, it affects our communities, it affects the health, and it causes a huge burden to the, to the health sector in terms of related diseases like cancer and other things. So definitely we need to, take this as a priority. So I think this webinar should put that as a priority, and we will work out a mechanism to prioritize the enforcement of the act and the guidelines right down to the ground level. However, my request would be, we need to do it systematically. If the health department also through a mission mode with the education department, calling together the police, organizes this awareness program at the Thana level, right up to the Thana level, so that the OC and others are aware of this and how they, because a lot of ideas will come from the ground also, in terms of enforcement, in terms of what the problems are, in terms of, because definitely, there are livelihood aspects. That is the other thing. Something that we can definitely enforce very easily in the sense of awareness is shops. So there are two parts of Section 6 as I was going through it. One is the prohibition on sale to, minors, to people who are below 18. So definitely each shop that sells tobacco products should have a standard, a sign saying that sale of tobacco products to minors is prohibited under the Act. And, this is the violation. And it should be in the local language, Khasi and Garo. And this can be really enforced so that, that level, the shops should be aware that if they're selling tobacco, it's their responsibility to place this sign and to ensure that for, people minors who come and buy this, it's a strict no. I don't see shops having this signage. Today, a lot of shops have the signage that fully vaccinated. Similarly, I think this can be easily done. And if we have a survey and police can, take it up as a mission mode with the health administration or the DCs, I would request, let us do this. Let us saturate, in each locality, shops that sell tobacco to have this sign, to say that under Section 6, this is what is the law. Then, then there's level of awareness. So, once there's a declaration by the shop owner, by the person selling, that is what the police can also enforce, that if they're selling tobacco and they're not declaring it, then, please don't, you're violating the law in a sense, because you're not informing the public or the minors. That is one, of course. The second is Section 6B, which is the 100 yards rule for educational institutions. I think this also needs to be really thoroughly enforced. And through this survey and through, an active mechanism, if we can take this forward and take it up in at least a few localities with the active involvement of the headmen, so that, they are made aware of these rules, because so that, so that, there is that active cooperation from the headman and the Nokma or the Rangbashnong concerned that, look, this is something that needs your cooperation, because the police can't do it alone. The district administration can't do it alone. We need the active cooperation of our community leaders, and to showcase to them that this is the problem that is at hand and they have to be part of the solution. So this data on the deaths, on the harmful effects have to be properly, done in a proper IEC format, for which I would request MD NHM and his team. and communicated both in the local language, communicated constantly, so that we keep reinforcing this, because sometimes people are aware, but it's not high on the agenda. Many people smoke, many people, smoke biris, there is no really stigma to smoking in the state, and obviously consumption of tobacco also, along with chewing of pan and kwai, and in the rural areas also, people also take in tobacco. I have seen. So how that can also be made aware, that has to be carefully worked out. From my side, I would request health, since you all are leading it, to work out a proper template. And if this data that you're talking about, the app that Mr. Ramkumar mentioned, can have feeding points. So if SPs can feed in data, or it's mandated to feed data every month, then only we can see progress. Unless you say that it's mandated to give some reporting, we will not be able to systematically look at it. And then data analytics will work out. You will be able to tell where things are lacking. We will know which districts are not reporting. Then a call from me can go. So that way we'll have this dashboard, and then we can systematically, through data analytics and dashboard, work out. And each DC or each SP should have control, or should have access to this data, both in terms of feeding data and in terms of viewing data. That's one. Educational institutions also should have it, so that they can also, if there are shops within 100 yards, if the principal or someone goes and says, please don't sell, who is going to sell? I don't think people will, violate the law. So they should also be made active in terms of enforcement, and in terms of doing this 100-yard rule. And who knows, I mean, if 100 yards is less, why can't we also petition the central government, or, through a forum that, we can also increase this if 100 yards is less. If we notice that people are violating it by making it 105 yards or 106 yards, right? There are many ways to, look at it, but it's still in the vicinity, because how do you measure this 100 yards is the other question. It might not be on the main road, it might be in some corner, but it's still 100 yards. So we need to, do that. So we are fully committed as the Home Department, the police, to support this. This is very important. I think it's really an important webinar. I can't overemphasize the importance of this. And I'm so glad that DCs and SPs have joined. But a proper mission mode way of working and reporting mechanism should be able to then show the way and the actionable points in which we can then systematically do this exercise in coordination with education, health, district administration, the police, and definitely principals of schools and colleges, educational institutions, and the community. Definitely at some, we have to rope them in, and we can make some of them ambassadors, where they can speak out against this, this menace of tobacco consumption and cigarette smoking. So with these words, I'll not take much more time. Thank you to Sir Sampath and the entire team, Mr. Ambrose, Dr. Lana, all the DCs for having invited me. Look forward to valuable suggestions and to working together to really end this menace for the state, and to have these actionable points, data points in which clear actionable goals is laid down for each stakeholder. Thank you very much. Good day to all of you.
Thank you very much, sir, for your very, very strong and powerful message, sir. And we are looking forward to more strong directives from you, sir, which will help us strengthen our moves in whatever step that we take from today onwards. In fact, sir, we are also trying to work on another section of CODPA, that is section 5, which is direct and indirect advertisements of the tobacco products. So we do not want these tobacco products also to be advertised openly. And sometimes we see here in the city also direct advertisements in the form of hoardings, and where into tobacco industry is also, they come and intervene when they know that the state is making sincere efforts to eradicate the tobacco products from the state. So this is also another step that we would like to take forward. And also, sir, we would also like to inform you that and request you, sir, to give strong directives, even the police department, all the police office, the police officers and the outposts and all to be tobacco free. If all the police departments, all the officers are tobacco free, this will also be a very good example, sir, for the state, and they will be able to enforce more, maybe when to help us with the enforcement. So once the police department is officers are also tobacco free, we will become stronger in each and every step. So that is a request that we need a help from you. I mean, to make all the officers tobacco free. And again, to work on the Section 5, the indirect and direct advertisements of tobacco products. So thank you, sir. We will be looking forward to more meetings with you and to hear from you, and also, sir, to get more directives from your side. Thank you, sir, once again.
Thank you, doctor. We will, yeah, point noted. We will, take action, suitable action. We will, do it.
Yes, sir. Thank you.
Thank you so much. Thank you.
Thank you, sir. So, yeah. So thank you once again. And we have come to the end of the first session of today's webinar. Now we will go to the technical session of today's program. And for the technical session, I will hand it over to Sambandh Health Foundation to carry forward or to move ahead with this technical session. Yes, Mr. Sanjay and Ashima.
Dr. Lana,
yes.
Dr. Lana, I have to leave for another meeting. So
yes, sir.
I will not be able to participate throughout this webinar. Thank you very much.
Thank you, sir. Thank you so much, sir. I'm looking forward to meeting you again. Thank you.
Thank you, Mr. Amos.
So I hand over the technical session to Sambandh Health Foundation. Mr. Sanjay and Ashima, kindly take this forward. Mr. Seth? Hello?
Hi, Dr. Lana. Sorry, I think some technical issue happened.
Yes. I'm handing over the technical session to you. Ashima, please take over.
Thank you, Dr. Lana. I think I must say that all the secretaries and Sri Ram Kumarji, I'm really inspired by the words which you the commitment is huge. And, very rightly said that when all these departments work together, we are bound to make difference. So thank you so much, sirs. And with that, the technical session, I would like to invite Sri Ranjit Singh. He's the advocate and he's been working in tobacco control from a very long time now. So we would be very happy to hear from Mr. Ranjit Singh.
Thank you, Ashima. Thank you, Dr. Lana and Sambandh Foundation and State of Meghalaya for inviting me to speak today. And I think the previous speakers have quite eloquently dealt with the issue. So, so I'll get on to my, one sec, let me have my screen ready first. Yeah. So can you see the screen?
Yes, we can.
Yeah, thank you. So I'll start off with basically asking all of us, why are we here today? I mean, we're not here to know the law. I think everybody knows the law. Everybody knows that tobacco should not be sold to minors, and there are different laws that deal with it. Tobacco should not be sold near schools. We are here, and there are different people. There are enforcement people from police. There is government people who are making the policy, and there are teachers who are looking after these children. We are here to take a pledge. We are here to take a pledge to protect those people who do not understand that they need protection. And we are here to protect them from an industry who's constantly targeting them. So that is why our role is very important. Therefore, each and everybody has a role. The education department people, the principal, the teachers have a job to report the violation, report the sale near schools, while the police has a job to enforce those laws. So we are here to protect those who need protection, and the fact that there is a whole lobby that is constantly targeting them. And there are certain facts that I will share with you. The one fact is that all the tobacco companies manufacture products that are meant for children. So if you go to a tobacco shop, you will find toffees, candies, they're all manufactured by big tobacco companies. Why are they manufacturing these products, or why are they manufacturing stationery products? Why are they having these school programs of spell bee and some? The whole idea is to catch them as young as they can, and the intention is very simple. They want to make the maximum profit. So the younger they catch them, the longer they can gain from it. That is the simple logic that they go by. So this is not something that I am saying. This is what their internal document says. This is what surveys say, and this is what the judiciary is saying. So I am talking about two judgments that has come out, one from the High Court and one from the Supreme Court. One is by Justice Khanna, who's now a Supreme Court judge. He, in 2000 state, in one of the cases related to tobacco, said the effort and desire to attract young and gullible to the world of tobacco has always been the objective of the manufacturers. Catch them young is their motto. So they are only focused on catching them as young as they can, so that they can make the maximum profit. The second judgment came out from Justice Singhvi, again this one from Supreme Court 2013, where he said that the unrestricted advertisement of tobacco attract younger generation and innocent mind who are not aware of grave and adverse consequence of consuming such products. These are not. So Father Caleb very rightly was pointing out, there are health advertisement on the tobacco packets, but the products are so loose. The product at times, who's going to explain to a child who's 8 years old, 9 years old, that about cancer, about these details. So therefore, our job is very important. And the national data that we see in GATS, about 27 crores adults using tobacco of 15 years and above. Recent global youth tobacco survey data, which says that most of them started before they were 10 years old. So these are very startling facts, and therefore we need to look into it. The law we are very clear on, but I'll just brief you on that. So firstly, I want to give a sense of pride to the fact that Meghalaya, before the national law came, had their own law for prohibiting smoking in public place and also for prohibiting sale to minors and near educational institutions. The national law came in 2003, implemented from 2004, but you in 1998 already had this law, which was there applicable till 2011, till it was repealed. But so Meghalaya was much ahead of the central government thinking about protection of child. So that's the sense. I just need to take you back that we need to revive that feel that yes, we need to protect these children. And one such example is the state itself had a law before the national law came. So the national law came in 2003. National law that we are dealing with is very simple. It's section 6, which says no sale to person below the age of 18 years who are minors. And then section 6B, which says no sale within 100 yards of educational institution. Then there were rules under this law, which said that you need to have a warning board at each shop that no sale to minors. Then, and the part B also had certain rules, but since today's focus is protection of no sale near education institution, I'll take that separately. But there are other laws also. There is Juvenile Justice Act, which has 7-year imprisonment if you give it to a child. So giving means not only sale, giving means even for selling, even for taking. So a very wide provision which happened due to intervention and of VOTV in 2015. That's a major leap that we got in the law. The second recent law of 2017, where they have 3 years imprisonment if you engage minors in the manufacturing of tobacco. So what are we seeing the trend? The trend that we are seeing that slowly other department, other acts are incorporating provision to protect a child, to protect a minor. Therefore, we need to be assured that there are enough legal principles that are available to protect the child. The second part is that the global treaty which India has signed and which more than 180 countries have also signed have an obligation under Article 16 of the treaty. The treaty is called WHO Framework Convention of Tobacco Control, and Article 16 says prohibition on sale to and by minors. So they have there is there's a state law, there's a national law, and there are global laws. So there is enough statute obligation that you have to implement these provision on protection of children from tobacco. The going into the rules of Section 6B that prohibit sale within 100 yards of education institution, they give specification that each educational institution has to have a board. So that's a mandatory thing. So you need to have a board that says sale of cigarettes or tobacco product within radius of 100 yards is strictly prohibited and punishable under Section 24. So this is the language of the board. The measurement has to be taken radially, as the board suggests, from the outer boundary of the educational institution. Then educational institution itself is very widely defined. It includes primarily, secondary and higher secondary, as well as college. And so almost every educational institution come within the ambit of this prohibition of no sale within 100 yards. Therefore, if we, tobacco control people at time and again, when they present, they are stated that, why don't you ban this product? So if you simply implement this provision, no sale within 100 yards of education, this would appear to be a ban on, because there are this law covers so many education institutions. Now, I think Dr. Lana also pointed out that I'll tell you about certain judgments. These are only some I have cited. I'm not going to take you into detail of them, because there are plenty of judgments on this. And most of the judgments, they were only doing what? Is they were monitoring implementation. Time and again, direction was issued to the police, to the educational department, to central government, that have a interdepartmental committee or enforcement, enforcement committee to ensure that this law is implemented. Some of the direction also very specifically said that you need to have a board at every education institution. So these cases, which comes from Kerala, Delhi, Bangalore, Jammu and Kashmir, Maharashtra, they are saying they are called monitoring litigation, monitoring petitions, where the court itself on the filing of petition monitors the implementation of law. So there are enough judgments that deal with this kind of implementation. I would only point out one which is slightly different, which is the Naya Baats, where the traders went to the court saying the wholesale shop should be allowed within 100 yards of education institution. The court not only said that this is a demerit good, it is only for commercial value. It also imposed a cost on the traders association. And the fact it also imposed a cost, and the fact that it cost a petition, saying that what do we learn from it? That both wholesale and retail shops, whether you're storing or whether you're selling, it's irrelevant. You cannot have any kind of shop which has tobacco within 100 yards of education institution. Then there are recent judgments where Dr. ToFEI organization working closely with VOTV also came out with a case where the court specifically said that please all the municipal corporation department to ensure that all schools falling under their jurisdiction has these boards, and there are no sale within 100 yards. So court, if you see right from Jammu Kashmir, which is at the top, to Kerala, which is at the bottom, have been consistently issuing orders for implementation of Section 6. So what is it that we take from here? We have local laws, we have national laws, we have international treaties, we have court judgments that all support, say one thing: protect children and no sale near educational institution. So takeaway from here, I would close it saying that, we all need to come together. And that is the whole idea about calling different people in this. And I'm really, really thankful to State of Meghalaya to initiate this kind of, seminar where you have the different department coming in together. And because one department, it is not a role of one department. If I say the law is there, the law has been there for more than 2 decades. It doesn't make until unless the law is implemented. And one good way of implementation is what the app that you have discussed time and again, the efficacy of the app on constant monitoring. So such monitoring is consistently required. This is what we saw in the judicial order also, that you need to have all the signboards in places. The signboards that you see there, you need to have the guideline which the government made to be implemented. So no evidence of tobacco use, whether by teachers or by anybody, there should not be any evidence. And consistent monitoring, whether through app or something. So the school itself has to take on that. I need to constantly report, about the violation. So that is required. And I'm very pleased about when I was listening to Dr. Lana's, presentation about the great steps and the outcomes that these constant monitoring and implementation has come, where schools, there's a list of schools with violation which is sent to the DCs and SPs. There's feedback which is from schools sent to blocks. Districts have taken action. Say near schools have substantially stopped. So you see the results happening. Firstly, the law is there, but if you constantly monitor and then you do a follow-up, so it's not that you stop on monitoring, you do a follow-up, that if you see, if you have a result of suppose 1,000 schools selling tobacco near this thing, then you do a follow-up with the DCs and SPs that please see that we have this list where the violation happening, please ensure. I think this is a very good example and which needs to be taken to other states also. And I would only request you to just consistently go on improving upon this data. And thank you. So once again, I would say that we are only here to take a pledge to protect those young people who are of impressionable mind, who needs to be protected from a huge lobby who's constantly targeting them through different initiatives, whether through advertisement promotion or through incentives, by film stars and others who are promoting these products. So thank you for letting me speak out here, and please keep up the good work.
Thank you so much, Ranjit. In fact, I'm very happy to note, I did not know this, that Meghalaya is already ahead. In 1998, they had this law there in place. So they were already protecting the minors. But one good thing you said is that law is there. The implementation, again, it's an important part of it, that unless implemented, it will not make that much a difference. So, and the departments have come together. We saw this in the webinar today. Thank you so much, Ranjit. So I think most of us here have pointed out very important thing, that yes, it is an interdepartmental thing, and we need a system. And we need a system that, how these sales can be stopped. So let's first look at it. We heard from Dr. Caleb and Dr. Lana about the number of deaths in Meghalaya. Let me share with you that there are 13.5 lakh deaths every year in India. And we have 28.7% of the population, which is 15 plus age, consuming tobacco in some or the other form. Dr. Caleb already shared with us, it showed that what actually tobacco does to a human body. Yes, we all know it is bad. But if we eliminate tobacco from the society, we can prevent 40% of all types of cancers. And 90% of oral and lung cancers will not be there. These cardiovascular diseases, which is 16%, these will not be there if tobacco is eliminated from the society. More so, in fact, India, the 6 of the 17 sustainable development goals, these are impacted by tobacco. It's a major risk factor in NCDs, the non-communicable diseases, cancers, CVD, respiratory, and diabetes. So it's a largest public health issue, which needs tackling, is why all the departments are very, very important. The coming together is very important. Now, what happens is that, the people who start consuming tobacco, 90% of them, they start when they are teenagers. And the quit rate is only 3%. So we have two strategies, that 90% of the users who are already addicts, either we chase them or we go into the prevention direction, which is do not start. So the best strategy is do not start, prevent them from starting. So that's the best strategy. We all must have this, is why the Tobacco Free Educational Institutions program is very important to implement in all over India. Now, clearly, Mr. Ranjit Singh also shared that, tobacco industry they target children. And what we found in other states is, in Meghalaya and other states, that the sales, these tobacco sales near schools are linked to usage. If you look at Andhra Pradesh, 20% of the users and the schools, the 22% are shops around those schools. And if you look at Karnataka, similar pattern is being seen, 22% of the users and 17.2% of the shops are there. So higher in Meghalaya, 47% is the current prevalence, and there are 43.7% schools have reported that there are shops around them. So higher the number of, the higher the prevalence, more the number of shops. It is seen in various states, in all the states we are working. So what does this show? This actually shows us, if we stop these sales near schools, the prevalence is bound to come down. It will be reduced. So is why very, very important to actually stop these sales and save our children. It has been a long-standing problem. Mr. Ranjit Singh already shared, there have been various high court orders, there have been PILs, which saying that these shops should not be there around schools. But what we are seeing in studies is, when, there are if a shop is stops selling tobacco, they come back after a few months. So what was needed was to have a system which will stop the sale. So in ToFEI, the schools need to report. The system is, number one is that the schools need to report that how many shops are there near your school. Number two, periodically, these lists, the number of shops which you have reported, these lists will be sent to the district authorities. They will, number two, B, they will take the action on these shops which are selling tobacco. And then after a few months, there is a feedback from the school which is taken, that whether the sales have reduced or not. So this system has to go on. It's like a cycle, because consistently after a quarter, we send the revised lists to the district administration, so that these shops gradually disappear from the schools. So we need to be very, very, this is a system which is important and is working as seen as in Meghalaya. Now what we request, we need your support from the district authorities to please stop these sales near schools. And from the schools, we want all schools to please complete the ToFEI activity number 9, which just asks you to report how many shops are there around your schools. Please go on to the web link and complete this activity. And after some time, there are feedback forms emailed to you. Please ensure you fill in these feedback forms so that we get to know whether the action has taken place. As Mr. Cyril said, that it is very important to monitor this. It is extremely important to monitor in order to get the difference on the ground. So that is where we need support from all of you. The state secretaries, they've all committed, they've all said that, we are supporting this, but these are the district authorities and the schools is what we require, this particular support from all of you. So thank you so much. That brings me to the end of my presentation. And I would, if there are a lot of questions which Mr. Ranjit has already answered, that why not ban tobacco, but we have very eminent panelists also. If somebody would like to please speak, will please unmute and speak. We would love to hear from the panelists, the other panelists who have joined, the deputy commissioners, the SPs. Anybody would like to speak? We have so many panelists here. Mr. Jagpal Singh Dhanoa, SP East Khasi Hills. But you will need to unmute. East Jantia Hills, sorry. Okay. We have the SPs from Mr. Siddharth Ambedkar, SP from Southwest Garo Hills. Okay, so please, you will need to unmute yourselves. Otherwise, we'll move on to the next speaker. We have Miss Jennifer Sinrim. Jennifer, can you hear me?
Yes.
So very important.
Yeah,
Jennifer has been really supportive in this program. I sometimes feel, without her, probably would not have been possible to actually have the action on the ground. So thank you, Jennifer. We would request you to please do the vote of thanks for this very important webinar. We heard from eminent people today.
Okay, thank you, Dr. Lana and Mr. Sanjay, Dr. Ashima and her team. Thank you so much for giving me this opportunity to propose a vote of thanks. So before we go for the vote of thanks, we were so happy. I have listened from our Home Secretary, Sir Darlong. He was telling that this was the best webinar since thousands of them are being in this webinar. So thank you, sir, for that particular reports which you have provided to us. It's really helpful. We are really we are working on it, and we're trying also to improve ourselves by working from hands and glove with Dr. Lana and the Team Foundation. So now also we are here with all of you. This program was a very lengthy program. We have started since January onwards. So which we have done in collaboration for both the health, the education, and now we are collaborating with the district administration and the SPs of all the districts. So I would like to propose my vote of thanks, especially to Sir Sampat, who is the Principal Secretary of the Health. He has really rightly pointed out about the life expectancy. So this life expectancy has been reduced in area, it has been reduced in region 2 due to the uses of too much prevalence of tobacco products. So I would like to urge all the participants, all the members, all the teachers to please take this very seriously. As Sir was also pointed out that we should conduct a survey. So this survey will be conducted for each teachers, and as my director, my secretary was telling Sir Ambrose that we should be honest in providing the feedback when it is a request from our side, so that the feedback, if we collect it, it will be helpful, and what you all have done under this ToFEI program, it will be implemented widely, and you will show it by your own work. So thank you so much, Sir Sampath, for that words and for that beautiful some notes which you have provided to us today. Thank you, sir. Now I would like to propose my vote of thanks to Sir ACH Marak, my director, who has been an inspiration and give us a very inspirational thoughts and support with his leadership and his commitment. It's really helpful, and we could be able to target more than 7,000 schools we have covered under this ToFEI program. So it is a really great achievement that you all the teachers, the cluster resource person, the block resource person, then the district coordinators, the district block mission coordinator, the DMCs, the DSEOs, the SDSEOs, it's all because of you that this was a success. So thank you so much for all these efforts that you have made. So I would like to propose my next vote of thanks to Sir Cyril Darlong, who is the Home Secretary of Government of Meghalaya, who has also provide us an in-depth thought on the usage of tobacco. He was highly pointed out that he will be having a review. That means fortnightly or every month. So he was even in the police department. This will help us to monitor and to see that these matters has been taken care and this awareness has been provided to each and every category, to each and every individual. It will reach because it is a joint collaboration, the collective collaboration of all the departments that we can do our work from. And this program will be a success, and the death rate in our state will reduce from 8,000 to 0. So let us work together, and as Sir was requesting us, let us also take from our own home, means do it first in our own home, not to use tobacco, then go through the schools as a teachers, not to use tobacco or quai, and in this manner, it will be a very great effort and achievement that we will protect our future generations. So thank you so much, sir, for that wonderful words which you have pointed out. Thank you, sir. So I would propose my vote of thanks to Sir Ram Kumar, who is the Mission Director of the Health Department. So thank you so much, sir, for those encouraging words and those words which we have been implemented all these months. It is with your help that we could do these activities in each and every area. Thank you so much, sir, for your generous and for your supports. I would like to propose my vote of thanks to Dr. Lana. Without her, this will not be a success. So Dr. Lana was rightly pointed out about the huge death rate in our state, and also she has rightly pointed out about the ToFEI programs and especially the sales of tobaccos in the schools area. That means no sales of tobacco within 100 yards of the school campus. And this was a best things that we have done in collaboration through this particular ToFEI program. And it has been a success as being reported, and that's why we are here today. So thank you so much, Dr. Lana, for your effort and for your hard work in this particular field. You're so committed to it. I really thank you. So I would like to thank Mr. Sanjay, Dr. Ashima, Arti, and Mr. Manish. These are all the team from Team Foundation, from Samban Foundation. They are so helpful. They call day and night. They try to reach all the schools, which is very impossible. But they have done a great job that we have achieved that 7,000 schools are being implemented, all these activities, including 24 activities that has been covered under the field level. So thank you so much, Team Foundation, for all your efforts. I would like also to propose a word of thanks to Sir Ranjit Singh, the advocate, who has really pointed out that it's about 40% of these law, or more than that, it's to target or to catch them young. So this is a message itself. Sir has rightly pointed out, he has done an in-depth surveys because there is a particular issue that catch them young. I also agree, sir, towards your words, because it is during when they are at the young stage that you can insert in the mind anything, whether good or bad. So I really agree to it, and I hope all the panelists, all my members, all the participants here also would agree to my words, because here that lies the duty of a teacher, the duty of the teacher, the role model, who are the role model for the kids, because this word catch them young means to catch them when at the early age. And when you see that more than 90% they start using tobacco at the teen age, so means at the school itself, they're still in the school at the age of 10 years above, 11 years above, they start using tobacco product, because sometimes for stylish, as to follow Rajnikant, sometimes to follow the actors, the actresses, because it's a fashion, it's a style. So please, it is the duty of the teacher to imbibe, to put in the brain of a young generation that they should not use tobacco at all, because tobacco kills, it causes cancers, and so many of the cancer cases also, it is due to the usage of tobacco, both the oral and also the other parts of the body. So it's very injurious, as Dr. Khalif also has mentioned in those videos, how you see, no, cancer is really dangerous and it's very causing. If you watch those two videos, if you use tobacco at any age, at any point of time, then the cause effect what will happen? Your death rate will reduce, and your burden to the family will reduce, and it will be a very expensive manner, because one chemotherapy costs you ₹1,00,000. So think before you use tobacco. So teachers, my dear teachers here, I still request you, please, to at least imbibe, educate your children, educate your students, so that they will not use tobacco. And please report activity number 9, so that we can give this to our people, to the concerned department, that is the police department, to do what they need to do from their own level. And in this manner, a collaborative, a collective approach will be effective, and your work which you have done in the field, you will see it by your own eyes. So thank you so much, Mr. Ranjit Singh, for this particular presentation of yours. It's really helpful, and it's really very interesting to know about all these matters that you have been dealing from the law of view also. Thank you so much, sir. I would like to last and not the least, I forgot to thank Dr. Khalif. Dr. Khalif was really very, he has done a very good job by showing the video, because seeing is believing. If we don't see it, forget it. No, nothing will problem. But no, because if you see that what is happening to those two patients, they became a burden to the family. And even one person, he lost, even the income level has reduces. Why? Because he is already into cancer. And then why it is causing him cancer? Because he is using tobacco. So in this manner, we should also stop using tobacco. Why? Because it kills and it is very expensive. So thank you so much, Dr. Khalid, for that particular presentation of yours. It's really very helpful for each one of us here, and I hope all my participants also has been getting all the message. Last but not the least, I would like to thank all my team at the district level. I would like to thank all the DCs who are present here. I would like to thank all the SPs who are present here. I would like to thank all my DSCOs, the SDSCOs, the DMCs, the BMCs, the BRCs, the CRCs, and all my dear teachers who are running this show. Without you teachers, this will not be possible. Thank you so much, and let's work, let's fight and make our Meghalaya tobacco free and reduce all the prevalence and the usage of tobacco. So with this message, I would like to conclude here. Thank you, all of you. Thank you.
And thank you, Jenny. Thank you, Jenny. This definitely wouldn't have been, like I said, we have to thank you as well. Yes, teachers, very, very important. Of course, the district authorities, the district deputy commissioners and the SPs are taking care at the district levels. But schools need to report and give the data, as Mr. Siddle said. Once we get the data is how we will actually take action then. So thank you so much. This brings us to the end of this very important webinar. And we enjoyed listening to very eminent speakers today, and Jenny, Dr. Lana, and everyone. And all our principal teachers, those who've not been able to speak, but we know you are with us. We know it very well. So thank you so much. Stay safe and have a wonderful day ahead. Take care and bye-bye. Jai Hind.